Hi everyone, welcome back to my channel. My name is Urvi Sharma and I'm a final year MBBS student at Maulana Azad Medical College, New Delhi. Our guest for today's video is a senior of mine and an alumnus of Maulana Azad Medical College, New Delhi, Dr Eashan Aneja. He is presently doing his DNB, which is post-graduation in internal medicine from Sir Ganga Ram Hospital, New Delhi, after completing his MBBS in April 2022. He has been a brilliant student throughout and a great inspiration for all NEET UG aspirants for the last many years through his writings on the web platform Quora. Talking about his recent achievements, he was selected for the Central Medical Services, cleared the Step 1 of the USMLE, and lately passed the NEET PG examination with an enviable rank of 1003. Today, we are going to discuss with him the options available to a medical student after passing the MBBS course. Our main focus would be on the Central Medical Services, Indian Civil Services, US Medical Licensing Exam, post-graduation through NEET PG examination, and INICET. I am very grateful to Dr. Eashan Aneja for sparing his valuable time, and I'm sure this interaction with him will prove to be of immense value to all new doctors. So before starting the question answer session, I would request Dr. Eashan Aneja to share some more biographical information about himself to acquaint our viewers better. Sir.
Okay, so thank you, Urvesh. I mean, that was wonderful, but I won't say I have an enviable rank. I mean, 1003 is like pretty fine. I am happy with it.
That's a great rank.
It's not amazing though. But although I prepared for USMLE all throughout my intern year, and NEET PG was a bonus. But I wouldn't recommend anybody to do that because it's way better to, ace one exam rather than sail through both.
Right.
But yeah, I ended up taking a NEET PG route towards the end because I believe that in India, the way you go through that exams and everything is very simple because once you clear the exam, the seat is yours. And nobody can kick you out of that institute. But in USMLE, then you have to clear step 2, then you have to clear step 3, then you have to have a great CV, you have to do researches, you have to pass an interview, and then you get a residency. And even that is something, something which they can kick you out of. So I believe that having some experience in home country would be better for me, even if I want to pursue USMLE in the future. But yes, everything has its pros and cons. This was the route I chose.
All right. Now, the first question that I want to ask you is, sir, you've been working for a few months at Sir Ganga Ram Hospital now, pursuing your DNB. So could you please share with us how your experience has been till now working there?
Okay, yes. So, so far my working experience has been 1 year of internship at Maulana Azad Medical College, a couple months of non-academic JRship at St. Stephen's Hospital in the Department of General Surgery, and a couple months experience in Ganga Ram. It's actually just 1 month experience in Ganga Ram and in the Department of Internal Medicine. But from each stages, I have learned that like in two broad categories, that life in a government hospital is very different from life in a corporate hospital. And you might like those differences, you might not like those differences. It totally depends on you as an individual. So I like those because I get ample time per patient. I don't have to rush through things. I can order whatever I want. They give me some independence, but I get controlled supervision as well, which is required for me at my trainee years at least. In government hospitals, you can get free hands-on for so many things, but it's also possible that you will learn the wrong techniques, you learn the faulty methods, and it will be very difficult for you to unlearn them at later stages. And this is what I noted when I joined my non-academic JRship at St. Stephen's. In Ganga Ram, I have quickly adapted and my experience at St. Stephen's actually helped me make a decision that yes, doing a DNB at Ganga Ram would actually make me a better doctor after 3 years.
All right, sir. So What differences do you find between the two places? Maulana Azad Medical College, the one where you did your MBBS, and Sir Ganga Ram, where you're working presently.
Okay, I think that internship part was excellent at MAMC. We get a lot of hands-on experience. We that it's very important for a young doctor to lose the fear of needles. Like I can
Correct.
easily poke my needle into anyone. I like initially I was very hesitant, and how those doctors have that attitude. Like so many people say that this doctor is so insensitive, that doctor is so insensitive. I think it comes with it. It's basically that confidence, because when I started my internship, I was very timid. Like I used to ask every patient, can I please do this, can I please do that? And but after a year I was like, no, you have to do this because it's for your own good. And I was like more confident that I was like 99% sure that if I poke the needle, I'll strike the right place at the and draw the blood. But when I was like at initial stages of internship, I was very timid. I used to take like 15 minutes for one sample. So that practical part of training, I think that's important. It doesn't matter whether you do it in your intern year or later on in your life, but yes, it has to be there. And I think only a government institute can give you that kind of a training scenario. In Gangaram, I do get hands-on. I get hands-on for, say, bone marrow biopsies. I get to do a lot of them. And we don't have to do sampling here because nurses do that. We just have to do ABGs. Yeah, we don't have to insert Follies also. We have to insert Follies in male patients because nurses are usually female and they don't insert Follies in male patients. And no, we don't even have to put Riles tube also. That also nurses do here.
Okay, so a lot of
yeah. So, but we really have to do it as a resident here. We have to my day starts like this. I usually reach the hospital at around 8 a.m. and then I start pre-rounds. And in pre-rounds, I just go through each patient. I ask them if they have developed any fresh complaint or something. Then I try to address them in my own way. Like if they're having cough, I try to treat them symptomatically there and then only. And suppose if potassium is too low, I just inform my consultant and I start potassium correction. Or if potassium is too high, I inform my consultant and start potassium correction. Or I directly start potassium correction and then I inform my consultant that yes, it was this, this, and that. So just in case it's this is what happens in pre-round. We start with sick patients, then less sick patients. But since we are a lot of residents here at Gangaram, we have divided our stuff into wards and floors. Like I take care of 3rd and 4th floor. My colleague takes care of 3rd floor COVID and dengue wards, something like that. So yeah, it's mostly that. And basically the stress, but there is equal stress at MAMC and Gangaram, but the stress at Gangaram is more doctor related.
All right, it's not documentation related work. It's less of that and more of clinical work.
Yes, definitely. Like and I have to type a lot of discharge summaries as well because everything here is digital. I don't have to physically carry reports. All the reports come to my computers, and then I have to enter the entire case summary. Like I have to write the history, I have to write the physical diagnosis, I have to write provisional diagnosis, I have to enter reports, and then I have to give follow-up advice to the patients. And that is part of the learning experience only, because that is when I get to know ki all right, this happened with the patient, and then we did this, then we did this, then we did this, and now we are discharging him with this advice. So it's a wholesome package of knowledge which we but yeah, it's at times it does get stressful in the sense that patients want discharged right there and right there. So it's like I have to type it in 1 hour, and patients are like, no, just give me now, give it to me now, etc., etc. So and sometimes I have to type discharges during the rounds. So and sometimes I miss rounds, and that is a pity.
Right.
But that's only in first year. I think I won't have to do that when I become a senior here.
Right. But the entire process there is digitized. So that must be relatively easier than MAMC, because here at LNH, most things are handwritten.
Yeah, definitely. Way definitely. Actually, yeah, but back there at MAMC, what they used to do was they used to fake reports, half of the reports, and then there was a serious loss of follow-up because even when they discharged the patients, uh, the patient was not completely all right or something, and even then they would have to discharge because they have to make new space for the before the next emergency. So that was the issue. I felt this is not wrong ethically, but it hampers learning because you never got to know if your treatment worked in the patient or not. Another factor I found which was wrong in government hospitals was that many of the generic drugs actually don't work. For example, at MAMC, whenever you are like having a very restless patient, you prescribe midazolam. Matlab, you send an intern with an injection of midazolam 5 ml, and then that intern just goes in there and injects the injection, and the child or that guy just sleeps, and you get those scans done. But if you ask anyone from BMMC what do they give for this same purpose, they will say ketamine, because central government supply of midazolam doesn't work, and whoever is trained in Safdarjung all tends to believe that midazolam doesn't work, which is not true. It works in MAMC. And but the thing with Ganga Ram is that there is a lot of we try not to use generics a lot. We use a lot of brand names only, and I am having a hard time cramming all those brand names. But yeah, there's every doctor seems to have their own favorite versions. And but yeah, I have seen this difference myself, that they actually tend to they work better for patients. They work like magic. They work exactly like how they are described in pharma textbooks.
Right.
Yeah.
All right. So now moving on to the next question. So what are the different career paths available for an MBBS graduate?
Okay, so I think one of them obviously has to be your medical officer, which is UPSC CMS. But you might want that. It totally depends on the individual whether he wants to settle as soon as possible, because there, I won't lie, but it's a really good part because you get government perks. Eventually you'll get to have a government house, you'll get quarters, you'll get a government campus, and you'll get everything you need. In fact, with basketball courts, with beautiful lawns, and eventually you might even get a government issued car and everything. Right. So I think it's not a bad option, and you'll get a decent salary, which is well over 1 lakh, which is like pay scale 10, which is as good as your IAS and IPS officers. So the thing is, exam is easy. It's very easy to crack, because half of the students who appear for the exam eventually end up doing MDs and MS and other post graduations. So I won't say that it's a bad option. I think if you're really considering to settle early, then you should go for it. And other option is, of course, your post graduation in India. And your post graduation in India, you have two options. One is MD/MS and other is DNB, and both are government issued degrees. MD/MS is issued by MCI, while DNB is issued by NBEMS, which is National Board of Education of Medical Sciences. So NBEMS is actually the organization that makes your NEET PG exam. While why are there two separate bodies conducting two separate degrees is an issue of debate, which I think it's because I can quote Dr. Abbas Ali, the orthopedics faculty of Marrow. He said that many of the private colleges which offer an MD course is owned by politicians, and they get a lot of commission from private MD degrees. That's why they don't want to mix these two degrees, like MD/MS and DNB. Yeah. So they want these two to be separate. And I have seen a lot of people who actually think that MD/MS is better than DNB. But when I actually visited the department at Sir Ganga Ram Hospital, I was like, okay, this is what I wanted from my life. They have excellent technology. There is no toxicity. They have regular classes. They have all the latest lab equipment as well. In fact, even my research thesis topic is based on a test which is worth 60,000 rupees, which my institute is providing it to me for free. One test
Okay.
costs 60,000 rupees to the patient, but I am able to do it for free just because I am from Ganga Ram. And so you get a lot of perks, and it's not like that these corporates have poor research culture. It's not even that. We have a separate department of research built inside the hospital, and it's very easy to do researches here because everything is digitalized. You can just type the name of the patient and his records will appear in front of you.
Yeah.
Back there at MAMC, you had to go to the medical records department and fish through old pages and old records, and that was very impractical. But here,
Yes.
you can easily get access to any data you want.
All right.
And yeah, so even in research culture, I felt because of this research culture only, I chose DNB medicine at Ganga Ram. Because even if I plan to pursue my USMLE step 2 and my plan to go to US eventually, I felt that my experience here would be of great help later on.
All right. So, sir, you had cleared the Central Medical Services exam with a very good rank, but you
Yes.
did not join it. So, could you please elaborate the pros and cons of this career choice, and who should choose this career, who should not, and why?
Okay. I think, like I said, if you're planning to settle early, if like there are many people who are like, no, I don't want to do graduation. But even, no, even that's not true, because you can pursue your DNB from railway colleges even if you opt for CMS. And some of the railway colleges offer excellent DNB courses. I mean, I have seen excellent cardiologists and CTVS surgeons from who had done UPSC CMS and then joined DNB Railways. They are like they have excellent clinical acumen. They have an excellent patient base as well, and their patients just love them. And I have seen that happening. So it's not like that, but it's like the order gets reversed. You do training first and then you do your post graduation, or you do post graduation first and then you do your training. That's totally up to you. If you want to train as a general practitioner and then pursue your post graduation, you can go for UPSC CMS. And if you want to do post graduation and then get trained in that particular field only, then okay, it's better that you do your post graduation first and then go for a job.
So, there is another government sector career choice, that of Indian Civil Services. So, how do you
Yes.
see this choice as a career for medical graduates? And, sir, how does it compare with the previously discussed CMS,
Okay.
the Indian
Yeah.
Civil
So,
Service?
okay, I got it. So, UPSC, CMS, and CSE. So, see, the salary is same, but people who clear CSE tend to have more power somehow. And with CMS, your promotions are slightly slower than that with CSE. And with CSE, you'll obviously have to study something which is way beyond your MBBS years. I mean, you'll have to do geography, civics, history, and God knows what. But is that I am personally biased against CSE because there was a lot of fight during those COVID era where we saw the VIP culture, being extremely aggressive in our government institutes, where much of the ICU 4 of Lok Nayak Hospital were reserved for bureaucrats and those royalty. So,
Right.
yeah. So I am kind of biased against them. So I really don't want to talk about it.
Okay.
It might be a great career choice for other people, but yeah, even if somebody paid me to study geography, history, and civics, I wouldn't do that because I love science and I want to stay that way.
Right. How do you see these two career choices in comparison to going for further studies in the field of medicine itself, like MD, MS, or DNB? Now, you mentioned that you're in favor of going for science subjects, but could you please elaborate on this?
See, if you go for CMS route, you will get ample time to study for both, be it NEET PG or be it USMLE. I have seen people who do CMS just to earn some money, and they then just resign and they go wherever they want to go. In fact, one of my colleagues had been a medical officer for 2 years before he joined DNB here at Ganga Ram, and he seems to have a lot more experience than we have. He's much more confident than us in patient handling and all. And so I don't think it's a bad choice. It's just that if it doesn't matter to you that I'll be late, matlab my colleagues would be PG3 by the time I'm PG1, or if these superficial things don't matter to you, then I don't think it should matter to first of all, it shouldn't matter to anyone, but if it matters to you, then you'll have to sort your life out.
Right. Now, if an MBBS graduate wants to pursue higher education in India, they've got two broad choices. One is the MDMS and the other is DNB. Both of these
I would say that these are the one and the same thing. You should personally visit the institute and see what you want. And if you like the work environment over there, then you should go for it. Please don't look at whether this is called an MDMS or whether this is called a DNB. They're one and the same thing. And many DNB institutes are ranked very highly.
So the question is about this only, like both of these qualifications are considered equivalent. So could you please explain the rationale for having two different pathways to reach essentially the same destination?
First, you have to understand that how the healthcare sector works. So in healthcare sectors, there is private sector and there is government sector.
Yes, sir.
In government sector, there is either free of cost or subsidized. In private sector, there is corporate hospitals and there is trust-based hospitals. The trust-based hospitals, one of the examples of trust-based hospitals is actually Ganga Ram. It's not a corporate hospital. These trust-based hospitals have excellent patient exposure. They'll get referrals from a lot of areas throughout the country even. They'll get excellent caseload. But if you consider a corporate hospital, they'll get very few patients. And the patient variety is also less. Quantity is less, but patient variety is also less. But in trust-based hospitals, they are working at more than 100% of its capacity. So less number of patients is never going to be an issue.
All right.
Yes. So I think you should go for either government or trust-based hospitals as far for your training. But excuse me, for some branches like DNB radiology, it doesn't matter from where you do it from. All you need is a good mentor and a good department, of course, because your center needs to have good X-ray machines, ample patient exposure, MRI, at least 1.5 to 2 Tesla or higher. And you have to have a PET CT now. Even that is a necessity these days. And basically, you need to have all the machines. In fact, you need ultrasound, and it should be, and there should be a provision that ultrasound for obstetric cases is done by a radiologist at that institute, because when I used to work at St. Stephen's, there are some hospitals where the OBG people do the obstetric ultrasound. So, and when you actually become a radiologist, that obstetrician wala ultrasound is actually mainstay of your income. Main source of your income, I mean. And so if you're not trained in it, you'll have to take a further fellowship course or something like that in obstetrics ultrasound. So basically your life will become slightly tougher if you go for, basically you'll have to look at the institute and see and talk to the residents and alumni from that place, and like what all problems they face, would they recommend this to anyone or not, or something like that. It's a very hard decision. I mean, even I haven't streamlined the entire process. It's a good question. I will do that.
Sure, sir.
Yeah. And about that, government वाले उसके अंदर जो subsidized है, उसका एक example हो गया PGI Chandigarh. PGI Chandigarh is not exactly free.
Okay.
It provides care at very minimal cost, but it is not free. And AIMS, MAMC, RML, these are free. But quality of care at PGI Chandigarh is superior to most government places. As
compared to MAMC and AIMS.
Probably not AIMS, because I haven't experienced AIMS Delhi. But MAMC, yes. RML, yes. LHMC, yes. UCMS, yes. PJ Chandigarh is superior. But
All right.
probably not AIMS. I'm not sure. But there are some private hospitals which offer excellent MD courses. It's not like MD, if it's an MD course, then it has to be a government institute. It's never like that. Like KMC Manipal has an excellent MD course, and CMC Vellore has an excellent MD course. And DMC Ludhiana has a MD course, and all of these colleges are private colleges. And so the criteria for a degree to be called MD/DNB is probably one of the criteria is number of beds at that hospital. If the number of beds is say more than 1,000, it's called a MD. If it's less than 1,000, it's called a DNB. If it's less than 500, then in order to take a government job, you have to do a 2 years of compulsory SRship at a government institute in order to take a government job. It's something like that. For most DNB courses, number of beds at that hospital is anyways always more than 500. You don't have to worry about that.
All right. So, sir, what were your personal reasons or special plus points for choosing DNB over the generally preferred choice of MD or MS?
Okay, so I kept the tag aside for a second, and I was like, okay, like, see, I have done my MBBS from AMC. I know the value of what a tag gives you, right? And
yes, sir.
Very frankly, it's not much. I mean, at the end of the day, I want to be someone who is going to treat patients individually and, be a better doctor, be a better professional. And I just wanted something in which I was sure that, yes, if I spend 3 years over here, I'll become a better professional. So leaving MD/DNB aside, I just chose something which I believed would help make me a better professional. And that's it. Like, even I would still say that if you still have doubts, just come to Ganga Ram and see for yourself.
All right. So could you share with us what are the differences that you notice between MDMS and DNB?
See, I don't think it's the difference between MDMS and DNB. I think it's the difference between each individual institute. Like, some institute can be offering an MD course and still have a bad course. And some institute can be a really good and be DNB, and some institute can be really bad and be a DNB. Like, all permutation and combinations are possible. So I think you should target the institute rather than the degree course itself. Like, for example, what are the good things I found here at Ganga Ram is that they have a journal club meeting once every week. So they discuss whatever updates have come in medicine and how can they incorporate that in patient care. Like, and they have seminar meetings every day. They have lectures every day. And this is something I did not experience back at MAMC, even for postgraduates, I mean. And because the patient load is so high at MAMC that it's literally a black hole. Patients keep on coming and you keep on doing work, and suddenly you realize it's the end of the day. It just never stops. So I think that there should be some balance between number of patients and the actual training/education you're going to receive.
Right.
So that's what was different here at Ganga Ram. But it's like we get really interesting cases as well. For example, I'll show you the type of cases we have right now. These are the cases I had in my ward a couple weeks back. We had a lot of cases of dengue because it's dengue season. Other than that, we had diabetic foot plus onychomycosis. We had a septic arthritis. We had a DRESS syndrome. We had a visceral larva migrans. And we had some cases of fever of unknown origin, which later came out to be spondylodiscitis. Then we had a pancytopenia case, which came out to be beetle deficiency after a worker. And then we had a bullous pemphigoid with Parkinson with nocardia pneumonia. And we had a complicated UTI. And we had one case of cadmium and cobalt poisoning. Other than that, we had a cutaneous T-cell lymphoma, which was mycosis fungoides. And we had a resolving hepatic encephalopathy. And we had a chronic ITP with mediastinal malignancy under evaluation, query thymoma. He also had vitiligo. So we were expecting some sort of autoimmune dysregulation there as well. We had one case of COVID, which was severe enough to warrant ICU management. And we had one interesting case of ITP in TB.
Oh.
And we had one case of multiple myeloma and one parathyroid adenoma. So the quality of cases we have here is like amazing. It's not just back there at MAMC, almost everything the variety of cases could be counted on your fingertips. Like one is COPD with exacerbation, one is valvular heart disease, one is CLD always, and one is one stroke patient. So the variety of cases I see here is like beautiful. I mean, there is a diagnostic dilemma, there is a therapeutic dilemma. You get to learn a lot from each case. And obviously it was overwhelming for me initially, but I think I'm adapting quickly and I'm getting the hang of
it. Right, sir. So now talking about INICET, earlier we could appear in the INICET November-December exam as well. But now we are not eligible for the same because the cutoff date for eligibility is 31st January, while we will be graduating in February. By we, I mean all the medical graduates from all medical colleges except AIMS probably. So this amounts to an undeclared reservation for AIMS students and an injustice to all other medical graduates. What do you have to say on this?
I would say that it's not in your hands, so just accept it and move on. I'm sorry, it might sound selfish at some point, but I think, but very honestly, you can't do anything about it. But it doesn't matter what you or I think about this, right?
Yes, sir.
It's unfair, so it's unfair. So we'll just suck it up and move on.
Right.
But other than that, if you ask me how is INICET prep different from NEET PG prep, I would say that NEET PG prep is slightly more conceptual than INICET. But what you need for INICET is actually not your notes. You need to have read the book in order to crack a great rank. But luckily for what happened in my case, I had similar ranks in both NEET PG and INICET. So that was because I only had a base of USMLE. And if you prepare for USMLE, you'll have a good base. And if you are ready to build a building above this foundation, I think that is a unconventional but ideal way to approach this exam. Right. I would say that even if you don't want to go to USMLE Step 1 prep is definitely going to help you out. Because people who actually managed to crack into top 30 in INICET are like some of them were my classmates also. And what I know about them is that they actually read the textbook. Like it's not that they did it selectively or something like that. They had a really strong base right from the first year till the end of final year.
Okay.
Yeah.
So, sir, now coming back to the MD, MS, or DNB question, which would make our entry into a super specialization course easier after PG? MDMS or DNB?
It's very hard to comment on that because but I would say that a place with better academics has to give you an edge.
Right.
So, like academics at MAMC is good. It's like I would say it's 8/10. It's that good because the alumni which come out from MAMC are so strong. They are like well known everywhere. So I would say that academics at MAMC, like MAMC Medicine PG, I'm talking about that. So I think it definitely gives you an edge if you're from such a great institute. But if you're from, let's say, DNB Institute, then you have to study harder than your MD counterparts because your DNB exam is going to be tougher. And
right.
that prep might give you an edge later on.
Okay.
But it's very hard because see, in your NEET SS, in your super specialty courses, again, there are two exams, NEET SS and INICET SS. Let's call it right. INISS. So in NEET SS, it's a common general medicine exam. But in INISS, you have to choose a subject for which you want to appear for. Let's say I want to appear for nephrology. So I have to prepare nephrology in details for this exam if I want an INI for my super specialty. But for NEET SS, I just need general medicine. So I think being at an institute with better academics in general, I think it will give you an edge. As far as NEET SS is concerned, for INISS, you'll have to like put in extra efforts, be it in MD, be it DNB.
All right. Sir, you had also cleared the step 1 of USMLE, but then opted for PG in India itself. So what made you change your mind to stay back?
Oh no, I will still appear for my USMLE step 2. I'm just like, trying to find the time to like prepare for it. But yes, like I said, this was something I was getting. And for USMLE, route is very insecure. I mean, it's not easy for anyone to just uproot their life from India and then settle somewhere else. Like there are a lot of variables involved. And like I said, in India, the system is very simple. You just clear the exam and seat is yours. So I preferred building a safety net here before, just uprooting my life from here. Like just in case things don't work out there, I still have something here.
To follow up to this question, in one of your answers on Quora, you had stated that you want to keep your USMLE dream live. So what exactly do you mean by this?
I believe that had I gone for a government institute, I don't think I would be here giving this interview. I would have been working in a ward only. Like I on a regular basis, I think I can spare 3 hours at least for my studies on a daily basis. I don't think this would have been possible in a government institute. And I get a good exposure to patients also. So it actually makes your USMLE prep easier to some extent, because now I can relate to those questions. When I started my USMLE step 2 preparation, I found that it was a beast of an exam. It was very tough for me. Many times I was like, oh my god, what is happening? Even like I would just forget what was happening with this patient midway between the questions. But now when I see those patients in real life as well, I think that exam is actually unfolding and becoming easier for me.
It helps remember when you see the patient.
Yes, definitely. Your practical experience is way better than whatever your book teaches you.
Right.
Like, for example, just now only I was like, we had a patient for sodium correction. His sodium was around 123. And first step the nephrologist did was he ordered serum osmolarity. And if you look at the actual algorithm, this is what we should have done. So it was embarrassing also, because I also could have ordered that. And we, we sent a referral to nephrologist for this. But yeah. But this is something that I used to solve regularly in USMLE questions as well. So you'll find such scenarios like this, like day in and day out during your residencies.
Right. So, sir, why did you not choose the conventional USMLE route of taking step 2 after graduation and then pursuing it further? Why did you instead choose DNB and then decide to go for USMLE after doing your DNB?
That's what I said. I wanted a safety net. Suppose things didn't work. Like, I have never been to US before. I have just heard good things about it, because I wanted to apply for some electives / observerships, but somehow I was not lucky enough to bag one in a timely manner. And I never experienced what kind of work culture they have. I'm sure that it is better, but I'm also sure that they have their own set of problems. It's like it's insurance company culture / I don't know, shootings and mass shootings, etc., etc. I think every country has their own problems. I mean, and so I'm not sure if I was like up for it or not. But yeah, as far as my career is concerned, I wanted to make it grand, and that's why I was like, I want to go there no matter when. So it's like, I don't care if I go there now or 3 years down the line. And I wanted to make sure that I have a safety net here, as in, just in case things don't work out there, or I'm like, no, I don't want to do this. I did not like this. So I can always come back to India and, carry on with my work, because once I become a postgraduate, there's no looking back.
Right. So the ultimate plan is to go to the US, but the DNB is like a safety.
Yes, definitely. But you don't know, because 3 years down the line, I might change my decision and say, I want to pursue a super specialty course as well, or I can go for MRCP route, and you never know. But the thing is that doing a DNB from Ganga Ram gives me flexibility in those options. That is the main thing.
Yeah.
So even if I choose to go for a super specialty course, even that is good at Ganga Ram. Surprisingly, we have excellent nephrology and gastroenterology department, and I am sure that if at all in a later date I want to pursue any of these two, I will still choose Ganga Ram over any other institute.
All right. Now, sir, after MBBS, it is a life-altering decision to choose a branch. So will you please guide us? How should we move in choosing a branch in light of your own experience in the matter?
Yes, I think you should go for a branch in which you are ready to work even on a bad day. That is first primary on how to choose a branch. People will say stupid stuff like surgeons are born. If you have doubts, don't take surgery or something like that. I joined non-academic JRship of surgery just to experience whether I have the temperament of being a surgeon or not. And believe me, my time over there was wonderful, and I was about to take orthopedics back at Mansi. But then when I came back and I talked to people around who were pursuing orthopedics, I realized probably it's not the branch for me. I love the subject, I love biomechanics, I love those physics concepts, I love vectors and pulleys, but still, it wasn't what I wanted from my life. So I recalculated everything. I figured out that yes, medicine is something I want, and I'm really happy with it right now. Even 2 months down the line, I have had some ups and downs as well, but these downs are also manageable. They are not that bad, and even my consultants are not toxic. They do scold me a bit, but yeah, but then they treat me the same day. So I think it's way better than what I experienced back at a government institute.
Right. So could you also guide all the viewers on how to go about choosing a branch? Because for me personally as well, it is very confusing at the moment on which branch should I choose.
Okay, I would say it's not going to be an easy decision at all, and I'm not sure if my method would work, but what most people suggest is first decide whether you want a surgical branch or medical branch. But I can tell you, this is how grown-ups think. Youngsters like you and me would think, we don't care how much effort there is in a branch, just tell me which branch has more money making potential. We youngsters are interested in that. But I can tell you that every damn branch has that. Be it ophthalmology, ENT, be it pathology, be it even microbiology, be it anything, every branch has that. Because even if you become a consultant, your salary in medicine is going to be 20 lakh per annum or so. And even that is, if you're lucky, you'll get that. But if you decide to go to a tier 2, tier 3 city, then your salary can be a bit higher. But obviously, people who are it's a compromise. And so how to choose a branch, right? So I think if you are into fine work, then you should go for opthal/ENT/ortho. Ortho has ortho spine. Ortho spine requires excellent fine work. So if you are probably passionate about anatomy or something like that, then you should go for ortho. But if you're confused between ophthal and ENT, then you should make a choice between whether you want to do more surgeries or more OPD work, because ENT has slightly more OPD work than ophthal.
Right.
And as far as other branches are concerned, I think I should mention this because anesthesia is a very underrated branch. I think it's an excellent choice. Reason being, It has a good mix of medical stuff, and it's a cool branch in the sense that your work hours are fixed. You get ample exposure to patients. You get since your work hours are fixed now, you get family time as well. And but the problem with anesthesia is that you can't escape night duties lifelong. Other than that, many anesthesiologists believe that they are playing second fiddle to the surgeons, which is not the case, because if you look at the life of a surgeon, it's going to be like, surgeon has to like, मतलब उसे patient पटाना पड़ता है OPD में कि मुझसे surgery कराओ, and that is not an easy job. And उसके बाद भी after the surgery he is on call, and for like 2 whole days he is worried sick whether this patient will bleed or not. Did I miss anything? Did I do that? Did I do this wrong or something like that? And obviously litigations are higher in surgical branches. So it's all just risk/benefit ratio. And obviously as a surgeon, you might end up earning more than your medical counterparts. But again, it comes at the loss of your personal time as well. And other than that, I think medicine and pediatrics are those branches in which you get the best of both worlds. Even if you want to do interventions or some surgery wala experience, you can get that. And in pediatrics versus medicine, I feel medicine is better because in pediatrics, all steps are harder than medicine. As in, right from cannulation, right from blood sampling is harder than medicine. Even patient counseling is harder. So every case becomes harder because again, you'll have to do genetics and congenital conditions in details, which is something I was not interested in.
Right.
And yeah, so peds was one branch which was like out for me. I would do anything, but I wouldn't do peds. But yeah, medicine is way better. Yeah, that's how I came to my conclusion. Actually, I know it's not a very well-formed thought, but I'll modify it and present it to you.
Sure. And sir, did you also consider radiology or dermatology or
yes,
other such
actually I did not consider dermatology, very frankly, because I can't imagine myself being a dermatologist. It's fine, but it's a very good branch though. Other than that, for radiology, yes, there are advantages for choosing radiology in the sense that you don't have to repeat your residency in USA in case you want to pursue USMLE in future. So that's a very good point to take radiology. But problem with radiology is that do you really want that? That's the issue.
So, sir, is the Indian radiology degree valid in the US?
No, actually they have a lot of fellowship seats over there, which their current residents are probably not able to fill them in the entirety. So they have some seats left always. So those other international residents can take those seats.
And then they can practice in the US after that.
They can practice, but they can't practice intervention radiology because for that they have to be a resident.
They can do the diagnostic part.
Yeah, they can do the diagnostic part. But even in US, there is a culture of super specialization. They call it subspecialization for some reason. And like you'll have to subspecialize in neuroradiology or gastroradiology or something like that.
All right.
Yeah, so it might be better for people who are like into radiology, into only radiology. But I don't think we get ample exposure in our undergraduate days. I don't think it's possible for a person to like radiology. But the problem with radiology I felt was that if at all I don't decide to go to US in future, then I would be stuck here in a branch I actually don't like. So that's why I took medicine.
Okay. The exposure for radiology is very, very limited at the UG stage.
Yeah, I mean, there are people who absolutely love radiology. They love the diagnostic part. They feel like they are Sherlock Holmes and everything, and I love that. But I never got that feeling while doing radiology or solving radiology questions. I mean, for me, it's actually black and white. For me, I personally go to a radiologist. In Ganga Ram, you have to discuss cases with radiologists. You take CT films there. You discuss what is this, sir, what is that. And that part is fun because you get to correlate it with the patient,
Clinic.
then it becomes fun. But the radiologist is not seeing the patient; he's just seeing the films. It's probably not as fun as it is for me. I'm not sure how it is fun for them.
Right. Because the patient interaction is also very limited
Yeah,
in
as in
radiology.
first you know what is happening to the patient clinically, then you go to the radiologist and now you can see the disease yourself because the radiologist points it out to you. See, this is ascites, see, this is pleural effusion. And I was like, oh, that's why I was hearing less breath sounds at this region. So it makes the correlation fun. And then you come back, then you give the patient treatment. For example, I know that this patient had some mediastinal lymph nodes and then he developed this effusion. So I am thinking towards, say, TB, and then we got some evidence of tuberculosis in this patient. Then we started ATT. Then after 3 months, we had a repeat X-ray and some of the symptoms got resolved, or we had a repeat CT and we compare it with the old CT. So, everything becomes much more clearer and prettier. So that's why I like medicine.
Right. So now coming to a question about super specialization. Sir, we all know that our country lacks a sufficient number of super specialists in the medical field, and the number of super specialty seats in the country is much less than required. Despite this, we heard that many super specialization seats remained vacant last year, especially in some very, very important branches like cardiology. What do you think are the reasons for this paradoxical situation?
Well, okay, first of all, you have to understand that what your primary MD medicine / DNB medicine training is, it is not what it used to be like a couple of decades back. For example, there is my classmate, and his dad is practicing as a internal medicine physician in Gurgaon, and he was reminiscing his old days at PGI Rohtak, and he used to tell us that in one emergency he used to treat 10 MI cases. But what is the role of a general medicine physician these days is refer those 10 MI cases to cardiologist. So so essentially your MD medicine degree is not exposing you to all the cases at all. You're not treating them, and you're just referring them to your super specialty people. So the reason why seats got vacant at radiology is that because most of the better centers with good infrastructure are already saturated with good cardiologists. So the competition is immense. And this is not academic competition. This is corporate competition. It's very different from like what we experience back at college and residency level. And yeah, so that is the reason why people don't prefer cardiology these days. But if you're like extremely dedicated towards it, then no branch is saturated for you. That is also true. But like these days, I think people are preferring nephrology, medical oncology, gastroenterology, and people who don't want to do interventions, they are going for rheumatology, endocrinology, and hematology as well. And it's not like cardiology is a bad branch. I mean, people who are interested are still going for it. But yeah, this is true that seats are going vacant, and it might have to do with the fact that some of those institutes which have like opened up NEET SS vacancy for cardiology is probably not up to the mark. Probably they don't have the infrastructure. They just want someone for cheap labor or something like that, and that's why the seat is going vacant.
Right. So a few reasons could be the lack of infrastructure and saturation in a particular field.
I would say it's not true saturation, it's apparent saturation, because I don't believe in saturation per se.
All right. So before winding up today's conversation, any parting advice that you would like to give to the future medicos?
Yeah, I would say like choose, please, as in, please keep your mental health a priority. I mean, you might feel like मैं बस ये 3 साल सहन कर लेता हूँ फिर लाइफ अच्छी हो जाएगी, फिर ये 6 साल सहन कर लेता हूँ फिर लाइफ अच्छी हो जाएगी, डायरेक्ट 6 साल न्यूरो सर्जरी का कोर्स ले लेता हूँ फिर शायद लाइफ अच्छी हो जाएगी. It's never going to happen, I can tell you that. If you want to make your life good, do it now.
Right. That is a very important point that you made.
Yes. Matlab, if you're not happy at some place, it's better to leave it right there.
Right. So, sir, before leaving, I thank you on behalf of myself and all the viewers for giving your precious time and guiding all MBBS students and new graduates. Thank you, sir.
Okay.